So today we're going to talk a little bit about proprioception. I am here with Carrie, Adrian, who is a fellow canine physical therapist, and I'm so glad that you took some time out to talk with us today. So why don't you explain kind of in your own words what proprioception is and, why it's important.
Sure, especially in dysplasia. With proprioception, for me, I think it's another somewhat overlooked aspect of VetMan. I think it's becoming more and more popular. But usually when we think of proprioception, we think of a neurologic patient, right? We think of a dog that can't walk or has a disc herniation and is down and is knuckling, right? And they can't, if you flip their paw over, they can't correct it and place it flat. Most of the time, that's what we think of with proprioception. But proprioception is across the board. It's an everyday thing. It's an everyday activity, regardless of what you do. In normal versus abnormal, you still have normal proprioception in every movement you make throughout the day in a normal patient. So the idea of proprioception is essentially awareness of body position in space. So I can close my eyes and I can put my arm up over my head. And without seeing it, I can say, oh, my arm's over my head. Oh, my arm's out to the side. Oh, my arm is next to my body.
Right.
That's proprioception.
And how does that work?
Yes. How does that work? You went to the neurodevelopmental?
Well, no, more just the...
I don't remember.
That there's sensors.
There's sensors
all over your body, in the muscles and the tendons.
And the joints.
Yes.
And any aspect of musculoskeletal health. You have joint proprioceptors. You have tendon. You have all kinds of sensors throughout your body that help you to maintain an upright position, that help you to stay upright, to keep you balanced, to keep you moving in a normal plane of motion.
And to prevent injury too. I'm sure you guys
True.
have all had the experience where you've started to step off the edge of a sidewalk or something, and before you can even think about it, you're already feeling your ankle trying to make those corrective motions.
All those small ligaments, tendons within your ankles. We've all rolled an ankle at one point or another. But
right.
Yeah. And the beauty of the proprioception, when we have them working normally, it keeps us moving in with the right mechanics. Mm-hmm. When pain sets in, when arthritis sets in, those proprioceptors can be off, right? So we start to see, not necessarily that scuffing and shuffling. You might see some of that, especially as hip arthritis, for example, we start to see those mechanics change. Mm-hmm. And the dog drops their rump, it avoids extension, and they're moving in a pattern that's less painful for them.
And what happens over time is then those proprioceptors get incorrect information, and so then they start to tell your brain,
this is the
right. So one of the big things that I think we try to intervene with as physical therapists or rehabilitation therapists is changing that input into those tissues to kind of reset those proprioceptors and try to get them to respond to more normal movement patterns.
And normalize what's normal, what's most appropriate biomechanically for your system in moving, and the most efficient, and the least apt to cause that injury. Mm-hmm. So yeah, proprioception is a huge part of what we do from a rehab perspective. Proprioception is a huge part of what we do from a physical therapy perspective. So we almost have to, well, I shouldn't say we almost have to, we need to address that proprioceptive input by altering the mechanics. Mm-hmm. We don't want that input. We don't want to exercise a dog in an abnormal mechanical position, right, because we're just feeding into that abnormal proprioceptive input. Mm-hmm. So we've got to correct those mechanics. We've got to correct that rounded posture, make it a more normal. So as those muscles are being activated, as those joints are being activated, we can increase the range of motion and provide a more normal postural and mobility type of function.
Right.
Yeah.
And what are some of the interventions that you like to do most for, put your hands on them?
I think as physical therapists, it's imperative, and that's what we do best, right? We are hands-on. We are feeling not just where that primary issue is, but don't be surprised, as clients, don't be surprised if you bring your dog to me, I'm working way up in the shoulders. I'm working way up in the neck even. So, when these dogs change their mechanics
in one area, and you think about it, what's
connecting front to rear, front legs to back legs, is that spine. So some of those forces are shifted and they shorten their stride. But in order to, you're not going to have a long stride up front and a short shuffling stride in the rear. The front also has to keep up with the rear and vice versa. So we get the change in mechanics up front and we see all of that altered mobility, and reduced range of motion in the forelimbs as well as the hind limbs. We've got to improve flexibility. We've got to improve that proprioceptive input to all of the joints of the mechanical chain, of the entire biomechanical chain, not just in rear, but in front as well. So when you shift, if I have a hind limb issue and I'm shifting my weight forward, what happens to my head? It's in this position. Well, if I'm going to see where I'm going and not run into Lisa, then I have to lift my head. What's it doing to my neck? So then we start to get compensation even in the neck. So the more chronic it is, the more we're able to detect these sudden changes and need to address it before we can really force the animal into any sort of dynamic activity and exercise.
Right. So the first thing is changing the posture, changing the mechanics, starting to reset those proprioceptors. But then we need to create movement, because that's really when those sensors work the best. And so then, once we change those postural abnormalities or compensations, then we want to provide exercise and teach our clients what to do at home to help maintain those changes over time.
And activate the specific muscles that maintain that posture. So if you're flexed in the spine, your epaaxials aren't working very well. Those are the muscles that run right along the spine, as you know. So if I'm stretching those, they're not working real well. So we've got to change that mechanics and elicit epaaxial activation to maintain spinal extension. It's retraining. It's a lot of retraining, a lot of hands-on.
Yep, we just got to reset those sensors and get them to work correctly.
You bet.
Well, thank you so much, Carrie. I appreciate it.
Of course. Anytime.